Hello. Thank you for joining us today over Zoom. We're really excited to talk about vaccines, which is a subject that is so important in keeping our kids healthy. I'm Lindsay. I am one of the nurse practitioners here at Fort Wayne Peds. I've been here for 6 years, and my fellow NP Casey is also presenting tonight, and I'll shift the screen over to her in just a minute. There we go. Okay. All right. So our goal tonight is to share clear and accurate information about vaccines. We want you to feel confident in the decisions you make for your children, and these decisions based on evidence-based recommendations of your provider. Vaccines are safe and effective. They prepare your child's body to grow, develop, and live a full childhood. So this is our vaccine policy here at Fort Wayne Pediatrics. We strongly support recommendations for vaccination as set forth by the American Academy of Pediatrics, or the AAP. So this is our policy for several different reasons. It's our job here at Fort Wayne Peds to protect all of our patients and their families, but especially those who are at higher risk for communicable diseases based on being immunocompromised or unable to be vaccinated for health reasons. It's also our responsibility to ensure a healthy community for our patients where they are not at risk for contracting a preventable disease. And it is our mission here to make the best possible medical decisions for children. Our vaccine policy is an important aspect of providing the best medical care for each of our patients.
All right, and I'm Casey. I'm one of the other nurse practitioners doing the presentation today. I am about to unload a lot of information, so at any point, if you want to step away, please do. And then we will save any questions, comments, concerns for the end. So write anything down if you have anything to go over at the end. All right, we are going to get into it talking about, is this a virus or a bacteria? So vaccines prevent infection from both viral and bacterial diseases. A virus is smaller than bacteria and requires a host cell to reproduce, and we know that there are limited treatments for viral infections. Bacteria are living organisms and can live both inside and outside a host. Bacteria are everywhere. They are in your skin, in your gut, they're in the dirt. We do have antibiotics for bacterial infections, so there is treatment for bacterial infections. That being said, why can't we rely just on antibiotics? While antibiotics are essential and commonly used for treating bacterial infections, vaccines provide the best defense from bacterial infection by preventing an infection in the first place. Relying only on antibiotics increases the risk of antibiotic resistance and doesn't guarantee protection against severe or untreatable bacterial disease. Vaccines can prevent disease from occurring, eliminating the risk factors associated with bacterial infection. We know that antibiotic-resistant organisms are a worldwide threat. Antimicrobial resistance occurs when germs defeat the antibiotic drugs designed to kill them. The best way to combat this growing threat of antimicrobial resistance is to prevent these infections in the first place, and we can do that by getting vaccinated. We know that some vaccine-preventable diseases can cause significant life-threatening symptoms within hours, and time to treatment is crucial. Antibiotics might not work fast enough to prevent long-term complications, such as hearing loss or seizures. Vaccination improves the overall public health of a community by limiting the spread of certain bacterial diseases through herd immunity, which is something we'll talk about later. Finally, we already have some bacterial infections that are difficult to treat, and vaccines are a tool to combat the spread of resistant bacteria. All right, my favorite part, talking about ingredients. So vaccines contain several key ingredients, each serving a specific purpose to ensure safety and effectiveness. Vaccines may contain extremely small quantities of some chemicals and cell byproducts that are used during vaccine production. The statement, "Everything is chemicals," reiterates that all organisms, including our children, are composed of chemicals. We determine if a chemical is harmful or toxic depending on the quantity or how much of that chemical there is. Per the American Academy of Pediatrics, decisions about which vaccine ingredients are safe are not based on disproven presumptions, but rather on medical evidence. So let's look at the evidence that we have. The main components or ingredients in vaccines are the active ingredients or antigens, the adjuvants, residual substances, preservatives, stabilizers, and water. Each vaccine component serves a specific purpose, and each ingredient is tested and closely monitored during the manufacturing process. So let's talk about their purposes. So antigens, hopefully everyone has heard of an antigen. Antigens are the active ingredient in the vaccine. The antigen may be a small part of the disease-causing organism, or it may be the whole organism in a weakened or inactivated form. The number of antigens administered in vaccines has decreased significantly because of the advancements in science and manufacturing technology. So we know in the 1980s, there were 15,000 antigens in the vaccines that we had to prevent 8 diseases in kids, whereas today we have fewer than 200 antigens in the vaccines we have that prevent against 16 diseases. This is a 97% reduction in antigen content in our vaccines. Why are antigens important? In order for your body to have immunity against a disease, your body needs a specific and unique antibody to fight that pathogen. For example, with the measles vaccine, the measles antigen is introduced in a live virus vaccine. It gives the body a weakened form of the virus, which allows the body to slowly build specific antibodies. If a child is exposed to the measles virus in the future, they have a unique antibody already stored in their immune system to fight off that virus. This is a video, but for time's sake, I'm not going to show it, but you can find it on CHOP. Dr. Offit is well known for his research and expertise in vaccines, and he talks about aluminum. So I'd recommend everyone to go over there at some point and watch this video. I'm sure we have all heard about aluminum and that it is in vaccines. So what does it do? It is an adjuvant. An adjuvant improves the immune response to the vaccine, sometimes by keeping the vaccine at the injection site for a little longer, or by stimulating local immune cells. Not all vaccines use adjuvants. Aluminum has been extensively studied and does not cause any long-term health problems. Furthermore, humans ingest aluminum every single day through eating and drinking, and in far greater amounts than they are ever exposed to in vaccines. This graph is a little blurry, but it's from the Children's Hospital of Philadelphia, and it demonstrates aluminum exposure over the first 6 months of a baby's life. And you can see that the amount of aluminum in all the vaccines that are administered to a baby in those first 6 months is significantly less than the aluminum they are exposed to in their daily life. Preservatives. Preservatives are another important component in some vaccines. If we have multi-dose vials, a preservative ensures that bacteria or fungi don't grow inside that vial. Some vaccines don't have preservatives because they are stored in one-dose vials and are discarded after the single dose is administered. The most common preservative is phenoxyethanol, which is used in a range of baby care products and is safe for use in vaccines as it has little toxicity in humans. Probably the most commonly talked about preservative is thimerosal. Thimerosal is actually a type of mercury called ethyl mercury. This type of mercury does not stay in the body, unlike the mercury we hear about in fish that can make you sick if you eat too much. Thimerosal was removed from childhood vaccines as a precautionary measure, not because evidence indicated it was harmful or caused, for example, autism. The reduction was part of a broader effort to minimize mercury exposure from all sources. Countless studies have shown that there is not a correlation between thimerosal and autism. Residuals are tiny amounts of various substances used during manufacturing that are not active ingredients in the completed vaccine. We have antibiotics. Those are used in some vaccines to prevent bacterial contamination during the production of the vaccine. Egg proteins may be present in some vaccines because chicken eggs or cells are used to grow the virus used in those vaccines. Yeast protein may be present because yeast is used in their production. Let's talk about formaldehyde. Formaldehyde is an essential component in human metabolism and is required for the making of DNA and amino acids. We all have detectable levels of formaldehyde within our blood. It is used in vaccines to inactivate viruses, detoxify bacteria if any are present during the manufacturing process of that vaccine. Almost all formaldehyde is removed during production of vaccines. The residual amount is far less than what occurs naturally in the environment. Dr. Paul Offit from CHOP has another great video if you're interested in learning more about formaldehyde. Vaccines do not contain fetal cells. Some vaccines involve growing viruses in human cell cultures originally developed from 2 aborted fetuses in the 1960s. These cell lines are still going. Purification processes filter the vaccine during production. Purification processes filter through so there are no fetal cells after production. So we reviewed antigens, adjuvants, preservatives, and residual traces. Surfactants are another ingredient. They keep all the ingredients together. And diluents are liquid used to dilute the vaccine. The most commonly used one is sterile water. Okay, stay with me. We've reviewed what is in, reviewed what is in the vaccines. Let's discuss the different types of vaccines manufactured and recommended by the American Academy of Pediatrics. So these are the main types of vaccine technologies used for vaccines that are administered to children. And to reiterate, the goal of all of these vaccines are to safely mimic disease while building immunity in their bodies. We have vaccines that weaken the virus, inactivate the virus, use part of the pathogen, and some that use part of the genetic code. A live attenuated vaccine is a vaccine that contains a weakened form of the pathogen. The pathogen has been modified to reduce its disease-causing ability while retaining its ability to stimulate an immune response. So you get the benefits of a natural infection without the risk of side effects or complications of that disease. Because they imitate a natural infection, live vaccines generate strong, lasting immunity, usually after only 1 to 2 doses. The next kind of vaccine we're going to talk about are vaccines that inactivate the virus. So inactivated vaccines use pathogens that have been killed or inactivated so that they cannot cause illness. The dead pathogen still triggers the immune system to respond. Booster shots are often needed to maintain long-term protection with these types of vaccines. The pros of these types of vaccines is that they can be given to those who have a weakened immune system. The next type of vaccine is a vaccine that uses part of the pathogen, so part of the virus or bacteria. This includes subunit, conjugate, and toxoid vaccines. Subunit vaccines show the immune system exactly what to target by using proteins or sugar molecules from that pathogen. Hepatitis B and HPV vaccines are subunit types. Certain bacteria, like Haemophilus influenza, type B or Hib, and pneumococcal, have a polysaccharide layer. This is a complex sugar molecule that's around the bacteria. And this is part of its outer envelope of its cell wall. This layer protects the bacteria from the environment and from the host's immune system identifying it. So in other words, I like to think of it as it having an invisibility cloak that allows it to hide from the host or from the child's immune system. So to bypass this with a conjugate vaccine, that coating, that invisibility cloak is attached to a protein. The protein helps or teaches the child's immune cells to recognize that invisibility cloak. A toxin is a protein from a bacteria. Toxoid vaccines target the toxin from the bacteria rather than the bacteria directly. The final type of vaccines are vaccines that use part of the genetic code. So these include messenger RNA vaccines or mRNA vaccines. mRNA are molecules that show the cell how to make proteins. The mRNA vaccines teaches the cell how to make a protein from the pathogen or from the virus or bacteria. That protein is introduced to the immune system, triggering a response, causing the body to develop immunity. I think it is important to note here there's no actual virus contained in the vaccine. And I like this slide too. If it isn't clear, mRNA vaccines cannot affect or interact with your genetic material or with your DNA. The mRNA from the vaccine does not enter the nucleus of the cell where the DNA is located. So following the introduction of the protein to the immune system, the mRNA quickly breaks down and is eliminated from the body. Okay, we've talked about ingredients, the different types, so let's take a step back and talk about immunity. So we have passive immunity. These are when antibodies are given to the child. Passive immunity is short-lived, meaning it will break down over weeks to months. The most recent passive immunity example is the new RSV monoclonal antibody that we have been giving the past 2 winter seasons. That typically lasts for about 8 months or gives about 8 months of antibodies to the child. There's also active immunization. This does not provide immediate protection, but requires days to weeks to create antibodies, but it lasts a long time in the form of immunologic memory. Vaccines contribute to this type of immunity. Oops. All right, the third type is community. It is also the least reliable form of immunity. Herd immunity is hopefully something we've all heard of before. As more people become immune, the pathogen or disease has a smaller pool to infect people, smaller pool of people to infect. So the result is that the community overall will have fewer outbreaks. Levels of herd immunity thresholds vary disease to disease. So we know that for measles, the community threshold needs to be 95%. Because, for example, measles is one of the most contagious, a community requires almost everyone to be immune in order to stop its transmission. The next slide is pertinent just to those living in Allen County. So it shows Allen County vaccination rates compared to the state of Indiana. This is for kids who went to kindergarten last year. Some of the driving factors behind our poor vaccination rates in Allen County include anti-vaccine sentiment, limited access for children to get their vaccines with not enough pediatric providers, and Indiana state law, which allows vaccine exemptions at school. I think this next slide shows how vaccine acceptance has changed. You have kids last year going into grade 12, and you can see their vaccination rates compared to the kids who went into kindergarten last year. And we can see that the MRI vaccine decreased from a rate of 96% in kids going into 12th grade to 89% in kids going into kindergarten. And as I said before, the MMR or the measles community herd immunity rate needs to be up to 95%, and we are well below that. Okay, the last part I'm going to talk about is the process of vaccine development. I want to stress that the development of a vaccine is a collaborative effort involving scientists, regulatory agencies like the Federal Drug Administration and the Department of Health and Human Services. It also involves healthcare professionals like our pediatricians and those involved with the American Academy of Pediatrics. And by the time the final vaccine product is offered to the public, it's been studied for up to 20 years and tens of thousands of participants by thousands of scientists, statisticians, and healthcare providers. So scientists are most often funded by the government or private foundations. They spend years researching whether their ideas will work. Many scientists' ideas aren't turned into products or turned into vaccines, but they have added to the general body of knowledge that is science through either presentations or peer-reviewed papers and journals. Before human clinical studies, a vaccine goes through preclinical tests. As technology has improved, scientists use computer models to predict how the lab tests will go and can omit the cost of keeping lab animals and exposing them to unnecessary risks. If scientists believe they have a product that would be safe and effective for people, they send an investigational new drug application or IND application to the FDA. So then when they have their study plan, scientists can now move into clinical trials. And I think this is repeated several times, but as the vaccine progresses through each phase, its safety and efficacy are closely monitored. Quick side note before moving forward, I think it's important to understand that prior to the COVID-19 pandemic and the production of the mRNA COVID vaccine, there was already research being done for a vaccine for coronaviruses. So a lot of people ask about, the COVID-19 vaccine being so quick. But it's important to know that there are no steps skipped in the production of the COVID vaccine. It was so quick because the 3 phases that we see here overlap. So instead of going one at a time, where there's typically a 1 to 2 year gap between each phase, all of the trials were planned at one time. Where scientists are able to read a virus's genetic code, which shortens the time that it takes to develop a vaccine. So with the help of all the scientists, healthcare providers, statisticians, they were able to accelerate the development of the mRNA vaccine in a safe and effective way. So we have phase one. It has a small sample size with less than 100 people. Trials are open in this phase, meaning everyone knows who gets the vaccine and who gets the placebo. If no one knows what a placebo is a harmless inactive substance, usually like saline solution. Um, and then when you start the phases, and from the beginning of phase one, any ingredient that's going to be used in the final vaccine product needs to be used in this phase. So preservatives, stabilizers, adjuvants, they're all necessary, and they will all be in the same exact ingredients in phase 1, 2, and 3. So in phase 2, it includes several hundred people and can take up to 2 years to complete. Phase 2, 3 trials are not open. They implement randomized controlled studies. So what this means that the volunteers and the scientists conducting the study do not know which of the participants get the vaccine being tested and which participants get the placebo. This is called blinding, and it's necessary to ensure that neither the participants nor the scientists are influenced in their assessment of the safety and effectiveness by knowing who got which product. The goal in this phase is for scientists to try and determine the proper dose of vaccine to be given while they continue to study the vaccine safety. Another part of this phase is they establish manufacturing consistency, just making sure that each lot or vaccine lot comes out has similar results. In phase 3 trials, participants are similar to the population that will receive the vaccine. So the vaccine will be administered to children. The participants in the study will be children. The number of participants is calculated so that there will be a statistical difference between the experimental group and the control group. So the experimental group, the group that's getting the vaccine, and the control group, the group that's getting the placebo. The goal in this phase is to identify rare side effects, look at the immune response, and identify if there's a difference between those who got the vaccine and those who received the placebo. Okay. Throughout clinical trials and after approval and recommendation for use, the FDA periodically inspects production facilities and keeps tabs on reported adverse effects. Going into approval and licensure. So if the FDA approves the vaccine for the general population, then we enter the 4th phase of the vaccine clinical trial. And this phase is ongoing because it tracks the safety and effectiveness over a longer period of time, continuously monitoring benefits and side effects of the vaccine. So we're looking at the safety, purity of ingredients, and the potency. Is the vaccine giving us the desired immune response that we are looking for? Now we need to get to recommending the vaccine for use. So this begins only after the FDA or the Federal Drug Administration license a vaccine. So providers can't just start giving the vaccine on their own. They seek recommendations from the Advisory Committee on Immunization Practices, or the ACIP, the Centers for Disease Control and Prevention, the American Academy of Pediatrics, and the American Academy of Family Physicians. Until this year, the ACIP would meet 3 times per year to review vaccine effectiveness, safety data, clinical trial results, outbreaks of vaccine preventable diseases, and vaccine shortages. Vaccines are tracked for safety and effectiveness over a long period of time, which I had said before, and here are some. We listed some places where people can go to report a problem. Always want to reiterate that just because someone reports a problem doesn't mean the vaccine caused it. We know that correlation is not causation. All vaccines undergo rigorous safety testing, but adverse events can occur following the administration of any vaccine. So anyone who suspects an association between vaccines and adverse event can go to the Vaccine Adverse Events Reporting System. Okay, handing it back over to Lindsey.
Okay, so Casey did a fantastic job covering all that goes into a vaccine and getting the vaccine out to immunize people. So now we're going to talk about the vaccines that we give here in our office and that are recommended by the American Academy of Pediatrics. So first, there is this timeline here, and you can just see how long vaccines have been around. And like Casey said, as science and medicine have evolved, so have the number of vaccines we have to protect against more using less. So this is just a really great iteration of that. So the first vaccine preventable disease that we're going to talk about is respiratory syncytial virus, or RSV. It is one of the most common respiratory infections to cause hospitalization of infants. This RSV is something that I think most parents, most people have heard about, know somebody who was affected by it. We have both had children affected by it, and it can cause hospitalization and long-term effects. Reactive airway disease leading to asthma. So as Casey said, we now have an awesome monoclonal antibody injection that we can give to babies immediately after birth, and it provides protection with those antibodies as soon as it is given. The other option for passive immunity with against RSV would be for a maternal RSV vaccine towards the end of pregnancy. So you can see here, this is a table that is showing on the disease risks. So if someone were to naturally acquire disease without being immune, versus the side effects from an injection or an immunization. You will see a table like this after each vaccine preventable disease that we discuss, and you'll notice that in almost all cases, the disease risks and risk for severity and complication are much more than from the immunization or injection. You also want to note that we have combination vaccines that we'll be talking about, and while the disease risks differ, the vaccine possible side effects are the same. So for RSV, you can see that fever, fatigue, loss of appetite, respiratory symptoms that can lead to bronchiolitis, pneumonia, respiratory failure, hospitalization, and there are infants that have died, compared to an injection that provides immediate protection where you have an ouchie site where the injection was given and maybe a rash. So next we're going to talk about rotavirus. So rotavirus is the leading cause of death from diarrhea worldwide, and 1 out of every 65 kids diagnosed with rotavirus is hospitalized, but the vaccine decreases this rate by 80%. What's unique about the rotavirus vaccine is that it is an oral vaccine, and so we want protection to be made in the gut so that if a kid is exposed to rotavirus, the antibodies, the protection is already there. So you can see here we have disease risks, fever, vomiting, and diarrhea that can lead to dehydration, very rarely intestinal blockage. Vaccine risk, most often it is loose stools, and usually when they're 2, 4, and 6 months old, you can't really tell a difference besides their normal stools. But sometimes low-grade fever, mild vomiting, mild diarrhea, like I said, and again, very rarely intestinal blockage. Next is polio. So polio is something that only humans can be infected with. It's a highly contagious virus. Thankfully, we have been able to eliminate it from our country due to vaccination, but there is still polio that remains worldwide. It's reproduced in the intestines, and it can travel to the bloodstream and then make its way to the brain and spinal cord, which can lead to paralysis and limb deformity. So you see here, there can be mild symptoms, but those can lead into meningitis type symptoms, paralysis, and obviously it can be fatal compared to pain, redness, swelling at the injection site. Hepatitis B. Hepatitis B is a virus that is 100 times more infectious than HIV. And so hepatitis B is a 3-dose series, and we do give a birth dose of hepatitis B. And even in a patient, a baby who is low risk, we did not see in screening for risk and only vaccinating those that were high risk, we did not see enough decrease in hepatitis B in the pediatric population. So by vaccinating every single child at birth, 2 months and 6 months, we have seen virtually no hepatitis B in children 19 years and younger. So most commonly, this is spread mom to baby, but it can be spread from casual contact with broken skin, or mucous membranes, like sharing washcloths, toothbrushes, razors. What's also significant about hepatitis B is that the younger someone is when they're infected, the higher the risk for liver disease, cirrhosis, and liver cancer from hepatitis B. So those are the things we talked about there. And again, vaccine risks, low-grade fever, pain or soreness at the site, and very low risk of allergic reaction. So hepatitis A is another virus that infects the liver. It is self-limiting, so there is no treatment for hepatitis A. The only way to get it is to ingest fecal contaminated food or water. And this can be transmitted up to 2 weeks before the person who is infected knows that they are infected or has any symptoms. So what's important about hepatitis A is that we have had outbreaks in our country at restaurants. So you think about people who are preparing your food, hand hygiene might not be the best. So to have this protection in restaurants, at daycare facilities is really important for our kids. So again, you can see we're causing damage to the liver, nausea, vomiting, fever, and jaundice, and vaccine risk, very low, with pain at the site and maybe a headache. Okay, so diphtheria is the first in a combination vaccine of DTaP. So diphtheria is a bacterial illness that can cause several different types of complications. Um, Most notably, it can cause a membrane to form over the upper airway, causing respiratory failure. And what's also important to see there is that even fully immunized people who have been exposed to diphtheria and have maybe a carrier for it are asymptomatic, so no symptoms, or have a mild sore throat. So again, we look at the airway, damage to heart, kidneys, nerves with diphtheria versus the vaccine risk, mild fever, not feeling well after the vaccine, which can last 48 to 72 hours. After that point, symptoms should not be attributable to the vaccine. Next part of that vaccine, DTaP, is tetanus. So tetanus is also a bacteria, but it is not transmitted person to person. So there is no way for us to fully eradicate tetanus. You are exposed to tetanus in the soil, dust, manure, through damaged skin. So we think about our kids. Where do they play? They play in the dirt. They play in the mud. They play in places we don't want to know about. And they almost always have some sort of boo-boo. And so we are exposing their skin or their broken skin to these dirt places they're playing, and they have a risk of contracting tetanus. So the most significant and well-known symptom for tetanus is severe muscle spasms. And these can go from mild to severe in just a week and can cause respiratory failure if the throat and neck muscles are affected. So the last component of that vaccine, the DTaP vaccine, is pertussis. So pertussis is also known as whooping cough or the 100-day cough. The whooping comes from frequent uncontrollable coughing and phlegm that makes it difficult for the person who is coughing, infected, to catch their breath, which leads to that whooping sound. This is a very highly contagious bacteria, and 8 out of 10 people who are susceptible or not immune will be infected with exposure. Significant for this is that often this is misdiagnosed or underdiagnosed in adults, which increases the importance of vaccination for our infants. And infants do have about 2 months of protection from the maternal Tdap, which has the pertussis component in there that's given at the end of pregnancy, but we start vaccinating as that immunity wanes. Okay, so we can see here uncontrollable coughing, like we talked about, cracked ribs, broken blood vessels, pneumonias, apnea. Obviously, this can be fatal. And then vaccine risks, the same as for diphtheria and tetanus as the combo vaccine. And here you can see the series that is given. Okay, so next we're going to talk about measles, which is the first M in the MMR vaccine. So, as Casey said, this is probably our highest risk of a contagious outbreak because if 10 people are in a room and 9 are susceptible, they will all get the disease. So, if we don't have those high levels of herd immunity, 95% or greater, then we can see these outbreaks that we have been seeing. And um, measles can cause lots of different symptoms, fever, very goopy eyes and nose, rash, but it can also lead to complications, ear infection, pneumonia, brain swelling, and kids have died from measles. There is one that I want to point out, the subacute sclerosing panencephalitis. So this is again brain swelling. This is a complication that can happen years after initial measles infection. So we actually in our country had a child die earlier this month in September um, from the SSPE because they had been infected with measles when they were young. And so another significant complication of measles, acquiring actual measles, natural infection, there has been several recent studies that have shown that having the measles vaccine can actually decrease the effectiveness of a child's immune system long term to not only future measles exposures, but exposures to all kinds of different pathogens because it decreases the effectiveness of lymphocytes, which is a white blood cell that plays a major role in the immune system. So this is not just short-term consequences, these can last a lifetime. So mumps is the second M in MMR. And mumps, as you can see, is a virus that causes swelling in the glands here in the neck and jaw. And before the vaccine, it was the most common cause of meningitis and acquired deafness. So you can see disease risks here. We talked about the swollen glands that can lead to, the virus can lead to meningitis, deafness, and miscarriage during pregnancy. So again, how we talked about at the beginning, we're not just protecting our kids, we're protecting our communities and those who are unable to get vaccinated. So vaccine risks, these were the same for the measles and will be for our next one, rubella, soreness at the injection site, low-grade fever, rash, maybe some low platelets and short-lived arthritis. Both of those would be transient things that would go back to normal and very unexpected. So rubella is also a virus that thankfully has been eliminated from the United States with the initiation of the MMR vaccine series. It can lead to hearing loss and congenital heart defects and anomalies. So rubella is the leading vaccine preventable cause of birth defect. Again, we're protecting those who are not yet able to be protected. Okay, so let's move on to chickenpox or varicella. So this is also highly contagious. If you were younger, not born or born before 1996 when vaccination started, you most likely had chickenpox. It's miserable. There you can have 300 to 500 blisters, and you just feel terrible. So this is, while we think of it as kind of a benign childhood illness, it's really not. You can develop complications like pneumonia, brain swelling. If a pregnant woman were to get this, there can be birth defects during pregnancy. And then the Ray-Johnson syndrome is swelling in the brain and liver. And then, you can also get secondary complications like an ear infection or a bacterial skin infection with the open sores and the open blisters. Those compared to the vaccine risks are much higher for severity. Okay, Casey mentioned this earlier, Haemophilus influenza B, or HIB. And before the introduction of the vaccine, HIB was the leading cause of bacterial meningitis among children that are less than 5 years old. So again, meningitis. So this infects the lining of the brain. Um, to note, this is also a commonly found flora or natural pathogen that's in the nose and the back of the throat. So if this is something that people are colonized with or just have on board, then that makes vaccination even more important. And you can see here meningitis, sepsis, epiglottitis, which is swelling of the upper airway, pneumonia, death, compared to low grade fever and pain where the vaccine was given. Okay, pneumococcal disease. So we vaccinate against a bacteria, strep pneumoniae, is the leading cause of 5 million or of ear infections. You can see 5 million ear infections every year. And to kind of hark back to what Casey was saying, pneumococcal strains have become more resistant to antibiotics. So that makes prevention even more important. So you can see here the complications: pneumonia, empyema, sepsis, meningitis, death. I will note that this is the most reactogenic vaccine. So if it's given in conjunction with the influenza vaccine, there is a slightly higher risk for febrile seizure after administration. However, again, that risk is low and not common. Okay. Human papillomavirus, or HPV. So this is the most common sexually transmitted infection worldwide. It can cause genital warts and cancer of several different regions. We start to vaccinate around age 11, can be given as early as 9 and up through the age of 45. But we vaccinate at 11. Preteens have a really robust and long-lasting response to this vaccine, and we're protecting before exposure. So also to note that the vaccine is extremely effective. It prevented 90% of HPV infections with exposure and was completely effective in preventing persistent infections and pap smear changes indicative of cervical cancer. It's also important to note that male mouth and throat cancer due to HPV has surpassed the rates of female cervical cancer due to HPV. So boys need protection too. So you can see there things that we've talked about. I will also say that I feel like there are a lot of anecdotal stories about different vaccine reactions after getting HPV. The data, the science studies that Casey talked about as rigorous trials, showed no increased risk for any other vaccine side effects other than those that are listed here and then are super common with every other vaccine that we give. Okay, meningococcal disease. This is protecting against bacterial meningitis. So we see that the risk for infection increases at less than 1 year of age, and then again at 15. So we're immunizing as best we can, as those preteen and teenagers especially. And that's because bacteria is spread by kissing, sharing food or beverages, spending lots of time with a group of people. You think college freshmen in dorms, they are 5 more times likely to contract meningococcal infection than those who are not in dorms. So we can see here meningitis, sepsis, and then you have other complications: limb amputation, skin grafting, hearing loss, seizures, kidney disease, intellectual disabilities from a bacterial meningitis infection. Whereas the vaccine risks pain at the site, fever, headache, fatigue. Again, that should not last more than 48 to 72 hours. Okay, last vaccine preventable disease that we are going to discuss tonight is influenza, which is great because we are right in the season to prevent. We like to say flu before boo. So get your influenza vaccine before Halloween. Keeps it effective, gives you enough time to build immunity, and keeps you protected through peak season. So this is typically covering 3 to 4 strains. It's updated twice a year. And what's important is it helps to prevent or decrease the risk of severe disease, hospitalization, and death, and also helps protect against spreading influenza to other people who might be vulnerable. And you can see most people have had the flu, and it's miserable. And, you miss school, you feel terrible, and then you can have the cough, you can develop bacterial pneumonia. And we have had children die from the flu. And so vaccination works, and the side effects are not nearly as difficult to manage as the disease itself. Okay, before we go into our common questions, does anyone have any specific questions on anything that we've talked about so far?
For the two people.
Yeah. Okay, so we are going to, like I said, go into common questions that we hear a lot. But if you do think of one that's more specific, then if you can either unmute. That'll probably be the easiest way. If you unmute, ask your question, and then we can try to answer it to the best of our ability. Okay, so I'm gonna
Oh, great.
leave Casey too.
Okay, common questions that we hear in the office. This one, very common. I don't want to overwhelm their immune system. Why are we giving so many vaccines at once? I know they have something going on this week and I don't want them to be sick. That we know vaccines don't overburden a child's immune system. Kind of talked about this earlier. The number of antigens, that active ingredient in the vaccine, has decreased significantly. I don't think we covered this as well, but it says vaccines use only a small portion of the immune system's memory. I think if you think about the minute babies are born, I guess even via C-section, like they're exposed to germs all the time, putting things in their mouth all the time. So from the day they're born till their 2-month visit, when they start getting vaccines, their body has already created thousands of antigen or antibodies from the antigens that they get from everyday life. So the answer to that is you are not overwhelming their immune system. Kind of the same. Why do they need so many vaccines? I already had this one. This is one of the ways that we describe it. We update or explaining it to teenagers. It's kind of like your iPhones. Sometimes you need to update your iPhone for everything to be working well. Kind of talked about this earlier too with if we do uh, certain types of vaccines and you need those boosters so that it has a strong immunologic memory. Whereas we know with like the MMR vaccine where you have 2 live virus vaccines and that provides long-lasting immunity. It just depends how the vaccine is made and what type of vaccine it is. Did I answer that?
Yeah.
We hear a lot, I want to do one vaccine at a time. No alternative schedule has been evaluated and found to provide better safety or efficacy, or enough immunologic memory, better than the current recommended schedule that we have now from the American Academy of Pediatrics. When we discuss in the office changing the recommended schedule, we need to consider potential consequences of each disease. So if we're not getting, DTaP and getting pertussis at that 2-month visit, what are the consequences if that baby gets whooping cough? Altered schedules don't have the data to prove, safety. And waiting to vaccinate basically increases our time of susceptibility and increases, possible spread of that pathogen in the community. So we know that the vaccine schedule that we have is safe and effective. So that is the one that we provide and recommend in our office.
It's also important to note that repeated visits to the doctor's office, so every week to 2 weeks that a patient comes back, we're giving a vaccine, they can associate the discomfort with the doctor's office. And every visit when they come here, eventually they won't receive a vaccine. And sometimes even just for ill visits. So if we can get all of the vaccines done to keep them safe, but also to kind of decrease the number of times they have to come here and get a shot, and it also decreases the burden on the family as well.
Vaccines aren't necessary. Hopefully this is something that we would hear from someone who would watch this, but or listen to this, but we know that this is an everyday occurrence now. You know, there is that kind of argument about like, I want my kid to get it naturally, but if you get natural infection, there's that risk of disease that you can get. And I think the biggest thing that Lindsay and I talked a lot about when we first started doing this presentation was, just because this child doesn't die, we always have like death as like, what could possibly happen if they get this, bacteria or virus. It also just disrupts their life. It can cause change their growth trajectory, disrupts their development. They're missing school. Um, Being hospitalized can create trauma. It's not just because they didn't die doesn't mean that something traumatic or negative didn't happen.
And if with vaccination, if we can prevent a child from dying, one death is too many. So if we have a way to prevent a child from dying, which we do here with vaccines, then it is something that is just essential.
Vaccines have too many side effects is something we hear a lot. Yeah, I mean, there are side effects to vaccines. Usually they're just localized, when it's just a local immune response, to that invader, to that vaccine that goes in. But when we have fever, that indicates the child's immune system is responding and it's making antibodies, which is what we want to see. So again, you might have some side effects, but as Lindsay pointed out, those may last 2 to 3 days, which are significantly decreased than the amount of time you might have side effects from an actual disease. Yeah. Okay. Vaccines cause autism. Let's leave it at this. Multiple studies have been conducted and have not proven a link between vaccines and the following health conditions: autism, SIDS, neurological disorders, diabetes. Dr. Paul Offit added again has a really great video about the MMR vaccine, which we won't play right now for time's sake. These are other helpful factual sources that we have: American Academy of Pediatrics, CHOP, immunize.org, and Institute for Vaccine Safety at Johns Hopkins. Any final thoughts, Lindsay?
Sure. So yeah, we understand that we presented a lot of information. You are presented with a lot of information about your child, about vaccines, growth and development with each of your visits here in our office. Not to mention the bombardment of information, whether it is good or bad, that is online and that is available now. That really has never been available before. So we just want to make sure that you know that first and foremost, if you have questions, concerns, those are great sources, but you are always welcome to ask us, ask your pediatrician, schedule a visit to only discuss vaccines that have been given, that will be given. We want the best for our patients here. And so if any way we can help make that decision, we're happy to have that conversation. So our immune systems work more effectively in response to vaccines. When we prepare a child's immune system to detect and resist a virus or bacteria, it protects them in the entire network of people they come into contact with, allowing them to grow, learn, and thrive throughout childhood. And ultimately, kids can just focus on being kids. So thank you for joining us tonight. Are there any questions that you can come off mute and have?
We can. Usually it would just come up in a chat, right?
Oh, yeah.
No.
Okay. All right. Well, thank you for joining us tonight. And this will be recorded and should be available on our YouTube or website. So you can look out for that.
All right. Have a good night.